Afternoon. I'd like to welcome all of our guests to our program today. We are very happy to have Scott Robertson, our Director of Behavioral Health, as our featured speaker, and he's going to talk to us about resilience today. Thank you, Scott.
Well, thank you, Melissa. I'm very happy to be here and really admiring the gentle work that our Live Well crew is doing in helping people get situated in Zoom. And I know that that kind of help is a really very important thing right now, and it relates very directly to the topic at hand, and the topic is resilience. And so I have a moment to introduce myself. As I said, my name is Scott Robertson, and I'm the Administrative Director of Behavioral Health and Recovery for Adventist Health Glendale. And just this last month, in March, I celebrated my 30th anniversary working at the hospital. So it has been a marvelous and exciting relationship for all of those years with this community. And in fact, I worked at another hospital close by in Burbank in the late 80s. So I've been doing work in Glendale and the surrounding communities for about 35 years. And it's allowed me to become very familiar with our community. And it's also allowed me through Adventist Health to provide lots of services for our community. And, today, what I'd like to be able to discuss is, strategies that we each can use to cope with all of the distressing situations that are at hand in our lives right now. And when I say distressing situations, we can all fill in the blanks on what that means, and I'll go over that more specifically in a moment. But by way of background, I grew up in the Midwest, a child of the 60s, born in 1962. So I am at the very tail end of the baby boom. So then my education, I have a bachelor's degree in religious studies and a master's degree in psychology with a focus on multicultural counseling. And that focus, multicultural counseling, has been invaluable for me working in such a culturally diverse community as Glendale has become. And it also underscores, my interest in learning about and understanding how other people live their lives. Some people would say that if you listen to some other person's music and eat their food, that you might understand their culture a little bit. I'd say that's a little bit true. But my background then has allowed me to work at the hospital as half a dozen different positions, beginning as a counselor in our addiction program, and then for many years as the program director of our addiction services, and for the last 7 or 8 years as the administrative director for behavioral health and recovery. And what that means is we have 5 departments in behavioral health, the most visible of which I'll describe for you, and that is we have inpatient acute psychiatric departments. That is when a person has severe mental illness that presents in such a way that is so profound that they couldn't function in the community on their own without being destructive to themselves or to other people. And that means that we're a special hospital where the community is concerned, and that is through Los Angeles County, we're appointed as an LPS facility. LPS means Lanterman Petrus Short. It's a 1968-69 law that governs most of California's activities where serious mental illness is concerned. In other words, LPS status means that our hospital can detain a person if we believe they pose a threat to themselves or to other people, or if they're gravely disabled. So that means that we intervene and help people during probably the worst crisis of their life. And we're very sensitive to that fact that when we work with our patients in the inpatient behavioral health units, they're probably having or have recently had the most difficult time of their lives, no matter what their, which mental illness they might have. So those are 2 units with 60 beds and about 100 110 employees in those areas. And then we also have a very, very special program, and that is called the Outpatient Behavioral Health and Recovery Services. And what that is a program with licensed therapists, a licensed marriage and family therapist, licensed clinical social workers, registered nurse, or a licensed psychologist. So those levels of healthcare professionals provide group therapy for people anywhere from 3 times to 5 times per week, anywhere from 3 hours to 6 hours a day. So that is a level of care that is a lower level of care than our inpatient units, but a much higher level of care than, say, once a week visiting a therapist. So this is a really valuable program. We have special tracks in that program for people to return to work. We have a special track for people who have already retired. We have a special track for students who are returning to school. And the reason we have this program and the reason it is so valuable leads into kind of naturally a discussion about, as the title presumes, about resilience. So first, to frame a little bit of where we're at, each of us could probably name the things that have stressed us out most in the last year and a half. But I could say that our pandemic um, has created an unparalleled level of stress in our community. And that level of stress includes disruptions in most of the major functional areas of our lives. And so when I say, the functional impairment, so that we could all be together on understanding this. When a person has depression, they may be experiencing feelings of sadness. They may be experiencing sleeplessness, change in their eating patterns, a change in their willingness to socialize with other people. They may see a reduction in their interest in their normal activities of living. Those are all symptomatic of depression. So most of us go through periods of life where we don't function as well as we have in other periods of our lives. One of the happy things that I can tell you as a part of our Live Well program is that seniors tend to have less depression than young people do. Now, most people might frame things in a way that is an ageist sort of framing. And that is, there are people who think, oh, as we get older, our friends and our family die and we, move away from working, and the self-image and the money that goes with that feels good is gone. And so a lot of people, when they retire, they might be depressed. But actually, that's not true. That is just ageism. That is just people, like assigning a stigma to aging that is really unnecessary and inappropriate. The truth is, with mood disorders, younger people are more vulnerable than those of us like me who are a little bit older. And the reason for that is that as we age, we have gone through circumstances in our lives and we've learned well how to cope with them. Younger people have been through many less experiences in life. And though some of our millennial friends might tell us that they really do know how to do everything, they in fact have not been through many situations that those of us at my age and beyond have been through. So, as I talk about that, we're talking about, depression, but the same could be said of anxiety and of all of the other mood disorders in between. The way they're measured is through a view of something called functional impairment. So functional impairment just means that we don't really need to treat somebody for depression unless they actually have been functionally impaired by the depression. So functional impairment would mean that a person is less able to conduct themselves in their normal activities of living. So whatever is normal for a person, whether it's work or school or caring for their home and caring for their loved one, whatever our activities of daily living normally are, if our depression has reached a stage where we have withdrawn from or shown an incapacity to do those normal things. Now, you see, examples of that are many that we'll get into, but The functional impairment is a standard, way to look at serious mental illness. It's the standard way that we look at substance use disorders as well. That a person may drink or use, drugs, legal or illegal drugs. They might use them on a routine basis, and they probably don't become diagnosable and treatable until the person's experiencing a functional impairment. So, a functional impairment with a substance use disorder would be, say, a person doesn't show up at work anymore. Say a person doesn't have contact with family members that they normally have contact with. A person withdraws from paying their bills. Those are all examples of functional impairment. And the very same functional impairments, withdrawal from normal activities of daily living, are the measures by which we look at depression about whether or not depression is an illness or if it's something less than that. So the something less than that is something that I'd be willing to gamble that almost all of us, if not all of us on this call, have experienced. And that is a thing called an adjustment disorder. So an adjustment disorder is a circumstance when our outside life circumstances have changed at a pace or at a severity that is so profound that we're not able to keep up with our activities of daily living on a routine basis. So the pandemic has definitely put the material out there for all of us to have an adjustment disorder. So that would mean, for example, maybe one of the things that you do. I can give you an example from my own life. One of the things that I do that I really enjoy, and it's not something that I do every day, but I would say that before the pandemic, I probably went bowling once a month. Now, I'm not a very good bowler. I'm kind of, like that angry bowler who throws the ball real hard, kind of grunts because, I'm competitive and, born in the 60s in the Midwest, I'm supposed to win. So I try real hard and I can injure myself actually with athletic competition. But, say, so a normal thing for me would be once or twice a month, maybe I go bowling. Well, guess what? Enter, COVID-19, bowling alleys are closed. And so one of those things that I normally would do would be to go bowling pretty regularly. And I'm not one of those guys with, like a bowling ball and shoes and a shirt. I'm not that extreme. So don't think of me as one of those bowling freaks. I'm just, a casual bowler. But you see, when we talk about functional impairment, if that's something that I normally do and it's removed from me, right? What it creates for me is a little cycle of grief and loss. And that little kernel of grief and loss is just about bowling. So then add to that um, physical distancing. Add to that needing to have the mental awareness to, you know, every time I leave the house, put one of these on. And then add to that, we set up in my work, we had to set up a whole series of limitations of our contact with patients on our unit to limit the exposure risks for infection. Then, furthermore, again, I'll just use my own life as an example. Previously, I probably had on average 4 to 8 in person meetings per day. And some days ridiculously more than that, and some days fewer. But now our meetings have been almost exclusively online. So what left with that, particularly for a person like me who's had long experience at the same organization, over 30 years, you develop beautiful friendships at work. And so those people that I would normally see are people who would normally come and say, "Hello, Scott," and they would probably give me a hug or a nice greeting or a handshake or just a nod of acknowledgement that we've known each other and worked together, for many years and we respect one another. Well, those moments are gone. Um, there is no longer the opportunity really to arrive early and stay late at a meeting to talk to somebody about some other issue. Why? Because when the meeting concludes, click, everybody goes off. The physical contact that we normally have with other people, vanquished. So, those things that are associated with the pandemic have probably made every one of us in this chat, vulnerable to an adjustment disorder. So again, adjustment disorder is not as severe as anxiety or depression, and certainly not anywhere near a psychotic disorder. But an adjustment disorder just means that there have been so many changes in the outside circumstances of our lives that we can't keep up with it emotionally. And what it can result in is withdrawal. Um, not doing the things that we might normally do to take care of ourselves. So, for instance, for me, that is pandemic related as well, is I'm one of those people who I've gone up and down in weight on a range of about, I've lost and gained at most about 80 pounds up and down over my adult life. And so exercising is pretty important to keep my weight reasonable. And a couple of years ago, I rejoined a gym, Gold's Gym here in Glendale. And it was very nice and I enjoyed it, and even paid for a trainer so that I wouldn't continue to injure myself. I had 7 years of playing football and 4 years in the United States Army Infantry in the 80s leaves me with a lot of physical, orthopedic challenges. So having a trainer and going to a gym was really good for me. I felt fit, I felt healthy, and the pandemic comes and boom, remove that. So you see what's happened through the pandemic is that some of the things that we did to alleviate stress, some of the things that we did to manage our health, our weight, and then certainly most of the things that we do to manage our mental health, access to them has been removed or eliminated. And the lack of physical contact is one that has had a profound impact on most people that I know. Meetings at work and other activities that I go to in the community, I'm a very physical person, and it is very normal for me in the normal course of a day, through work and my personal life. I might have, say, four at a minimum and 20 at a maximum, hugs, pats on the back, or physical contact with another person every day. So enter COVID-19 and all of that physical support, all of that affirmation, all of the love and acknowledgement that I used to receive removed. So these are pretty grim times emotionally for many, many people. And I would say that it's absolutely normal that all of us have probably had adjustment disorder. And the challenge created by an adjustment disorder is that if it doesn't resolve itself, which is what happens in most cases, if you looked back over the course of your life, you might see times in your life when maybe you had an economic hardship, maybe you had a separation or a death in your family. Maybe it was just a move from one city to another. Those moves, those changes in life will often create an adjustment disorder, but most of us then get back to our normal habits of daily living in a couple of months. That say after we move, after all the boxes are unpacked and the ones that we aren't going to unpack are put in the attic or the garage to be forgotten until we realize that we don't need the stuff that's in those boxes anymore. That after a couple of months, we re regulate ourselves. In fact, when we look at people in the behavioral health setting who are thinking about making a change, in other words, they're thinking about getting treatment for a mental health or substance use problem, the crisis that opens like a window for change is about 72 hours. So people can sustain an attitude of crisis ready for change for a couple of days. But after a couple of days, if the crisis is not addressed through treatment, through getting access to services, a person's willingness to make changes like getting help diminishes. So, I mean, one of the realities that we know that relates to that is when a person calls our hospital and they're looking for help for a substance use disorder or a mental health concern, we know that we need to talk to them that day, not the next day, not the next month, not the following Thursday at 2 p.m. Because what we don't know is if the crisis that brought about their willingness to change, we don't know if that crisis came about 10 hours ago and they'll be in a crisis mode ready to change for a few days, or if they're calling us in the 71st hour of a 3-day crisis for change. Because then if we don't respond to them until the next day, they might have normalized again. Because what we do is when we have a crisis, we might be willing to address it, but that willingness dissipates as time goes on over a couple of days. So with COVID, the crisis, the change that's happened for all of us in physical contact and the activities that we normally engage in hasn't been lifted 72 hours later. So we have to try to normalize these conditions. So normalizing or making it routine to walk around, wear a mask, to normalize not having physical contact with people outside of our home is very difficult. And most of us have probably suffered some sort of adjustment disorder or depression or anxiety. So the challenges I've spent maybe a long time talking about, but I wanted to frame them in terms of how we work with people with behavioral health concerns, because therein is a roadmap about how we can cope with and survive and maybe even thrive during a period of time like COVID-19. So the strategies that I'd say are valuable are many of the same strategies that we use to 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 cope during normal living. So a roadmap that each of us could use is if we looked back into our lives at a time when we had a lot of change. And during that time when we had a lot of change, it might have been a marriage, might have been a divorce, it might have been a, a death in the family, it might have been a new job. Look back at the things that maybe dropped away for a little while, things that you didn't do, but then that in the following weeks and months, you were able to get back into. For many of us, exercise is one of the first things to fall off the list. That we normally had a routine of walking a certain place, and now COVID, maybe our place to walk was the mall. Well, that's not so available. Even many public parks, had prohibitions and limitations on what you could do there. And many public spaces that were indoors were just closed. Museums, for example, many of them just closed. So, if those were things that could help us to recover previously during tough times in our lives, reincorporating those activities could be useful. The challenge created is that most of the time when we do those things, we don't do them alone. And COVID has been a disease that has really, left many people very much alone. The sad thing that has happened, and we've all seen, and maybe know of family members or friends who have been hospitalized with COVID and are not able to physically be close to their family members, though they might be critically ill. So this disease has really isolated most of us. So the things that we can do that would assist in bringing about more normalcy and improving our strength, our resilience, our capacity to withstand whatever duration this pandemic has to in store for us. You see, nobody knows right now. A lot of things in California and across the country and across the world are opening back up. But you're probably also aware that not a significant volume, or a significant, but not a large enough volume of people have been vaccinated. We also, know that the vaccine is safe and it's relatively effective. We don't know exactly for how long it will be effective. So these stressful circumstances from the pandemic, may be going on for a while to come. When I spoke with our team at the medical center about our conversation today, they mentioned that the other stressors that we're relating to have been political turmoil. We have had very contentious and very difficult election practices that have sometimes taken the rhetoric to a place of enemies rather than having different views, and that can create another cycle of grief and loss. Because if we have rampant disagreement with another person's view, Right now, all of us have a stake in public policy. Public policy, where this pandemic is concerned, has to do with what's open and what's not open, has to do with whether or not and how people get vaccines. So we all have a view, of what things should happen and shouldn't happen. And unfortunately, we've seen a polarization, in our politics over some time now, where the rhetoric has escalated to the point of calling people of the other party an enemy, or calling them unpatriotic. And those things further exacerbate the stressful state that we're in as a result of the pandemic. And then fold into all of that the economic hardships that we all face, the economic uncertainty that we all face right now. And when I say, that economic uncertainty, our economy has shrunk tremendously. And I know that again, to provide a live, real personal example, my favorite restaurant on earth, if I could have only eaten in one restaurant in the world, it would have been this little hole in the wall down on Olympic by New Hampshire called Beverly Soon Tofu. It was reviewed by Jonathan Gold, the Pulitzer Prize winning food writer for LA Weekly and the LA Times. It was reviewed by Anthony Bourdain from a television show, Andrew Zimmer on a television show. There's this lovely woman named Marilyn from South Korea. Marilyn opened that restaurant because she ardently wanted her three daughters to be able to go to USC. That was her goal. And so that's many years ago. I went to her restaurant for the first time in the 1980s, shortly after it opened. And it was a place where I could get this fantastic meal that was very different than the food I grew up with in Northern Illinois, very plain Midwestern fare, shall we call it. So the beautiful tastes of that place just really were exciting to me, and I loved that place. Well, about 8 months ago, Marilyn, I talked to her. She had actually become friends. Her youngest daughter had graduated 2 years ago from USC, and the pandemic had brought about havoc in her restaurant. And so she decided to retire and close it. So she closed it. So my favorite restaurant on the planet, gone. So previously, like if I were feeling blue or having a stressful time, I might make a dinner date to go to Beverly Soon Tofu to have this food that's really comforting to me and enjoyable. And that's not available anymore, you know. And then all of us can probably go through, I don't know about you, but as I drive around, I see, businesses that I've gone to for many years here in Glendale and in other parts of Los Angeles. I drive by and I see them boarded up, for lease. And we're all going through a period of grief and loss and stress that that I don't think any of us have experienced anything like this before. So the things that we can do are to learn alternatives, um, to comfort ourselves and to bring about some happiness and some relief in our lives. So one of the tools is the tool that we're all using right now. Though online doesn't bring about the pat on the back or the hug or the physical affection that we might be used to, at least human contact where we're talking to and interacting with another person is very valuable during a period of physical or social isolation. So learning to participate as each of you have, I admire, that the adoption of new technologies is not something that comes easily for me. I struggle in my own work life with all of our information technology systems, keeping up with them and being able to use them in a timely way is challenging for me because they're not necessarily intuitive, and so some of those innovations cause me stress. So I have to get support. I have to get help, to get through that stress. Just like each of us, then, in coping with the isolation that comes with this pandemic, we need to have contact with other people. So I'm very happy too that our Live Well program here offers programs like this, where you're seeing and listening to other people and will have an opportunity to ask questions. It's really important that we have that kind of contact. It validates us. It helps us to feel acknowledged and presence that we still matter, that we're still relevant, because the isolation brought about through COVID has left many people not having those feelings, not feeling like they're important, feeling very alone and isolated. So having contact with people is probably the most important thing. Other things that I can tell you now, this you might laugh and think that this is silly, but I'll tell you, in the first maybe 12, 14 weeks of COVID, I worked 6 days a week because we had an incident command center going on at the hospital, and we wanted to have a director level person there to make sure that PPE, the masks and gloves and so on, was in short supply. So we needed to distribute it every shift for fear that some of our well-intentioned nurses might stockpile some of it for their associates, and then we'd end up short in another unit. So we managed through that period of time beautifully, but it was very, very stressful, working extra hours and not having the normal rewards that we have in seeing other people. And, you know, um, it was a difficult period of time. So I'll tell you what probably got me through those first few months of COVID was two things. And prayer and meditation, maybe, but not really. The truth is, macaroni and cheese and Oreos. Um, now it sounds like a flippant thing, but actually, what it is, those are things that I normally didn't eat particularly much of. But it was a thing that made me feel like kind of satisfied. Like if I make a little, a little carton or something of macaroni and cheese. It's not my favorite food, but for some reason, it satisfied a part of me. So, like finding food that hits a certain thing for you, provided it's not going to be setting you up for other dietary consequences. I didn't eat, whole packages of Oreos. Like I would restrict myself to maybe one row. Um, but I'll tell you, now that might be ridiculous, but doing those things helped me to connect with being kind of silly. It helped me just, the taste was good, but it let me do something that was kind of normal. Like those foods have usually been in my home since I was a little kid. And so having them at one level, I know that my mom's main stress relief when I was growing up, one of her favorite things to eat was, and this is how poor I grew up, is Kraft macaroni and cheese, a little blue box. And so I know to this day that when she's feeling a little bit blue, it's either Kraft macaroni and cheese or popcorn. That those are foods that for her really, resonate. So, making sure that you have food that at some level is comforting. And I'll tell you the other side of that for me too. I used to struggle more with my weight, and I've been stable, having lost about 70 pounds for a couple of years now. And that weight loss is no longer through a restrictive program, but actually, I eat some of the things that are probably considered pretty sugary or pretty fatty or pretty bad, but I eat a little bit of them because they satisfy me. And if I feel satisfied from eating, then I don't go on snacking. So I find that if I like actually make sure to include like a little dessert with my lunch or my dinner, I feel satisfied after I'm done and I'm not hungry for many hours later. If I eat, like a very strict salad, low fat, blah, 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 I probably by 2 o'clock, I'm going to be looking around like, maybe I'll walk over to the cafeteria and get some cookies. And, then I get cookies and an ice cream bar and, not good. So giving ourselves something like that is very important. The the other thing that I think we do in treatment that we can do for ourselves is a thing called reframing, and it comes from cognitive behavioral therapy. So a reframe could be, um, a person say they experienced some significant neglect as a child, and in experiencing that, there's loss and there's some sadness and maybe some missing instructions about how to live life. So we could help a patient in treatment who'd had that experience to reframe that experience with their parent, to note all of the things that they did learn and all of the things that they did get. Because if they write a balance sheet, for example, of what was neglectful and missing and what they did get, sometimes they find out that the balance was on the what they got. And they can hold on to that and look at those positives, and it diminishes the impact of the neglect. And it's not to give people a pass on maybe negative things that have happened, but it's so that the person is actually able to see in a more balanced or objective way, the good that was in that relationship. So reframing can be a tool that we use ourselves. So the reframe for me will be, that, well, Marilyn retired and closed Beverly Soon Tofu, much to my chagrin. Though that restaurant is gone, other entrepreneurs are going to be opening other restaurants in the near future. And I have that to actually look forward to now. And I'm actually a little excited because there might be new restaurants that I find to be just as wonderful for me as that one was. So the reframe there is anticipating that which is coming after this difficult period of time, rather than spending time lamenting that which has been removed. So that sort of a reframe can be a helpful tool as well. So there we are, pandemic, political challenges, economic uncertainty, certainly lots of racial tension and real challenges in how we treat one another. With all of those stressors going on, and all of us probably having at least an adjustment disorder, and if not, we may be experiencing something more difficult. The solutions could be then, if it's more than an adjustment disorder, if you notice yourself that you're really functionally impaired in many areas of your life. You're not taking care of your physical health. You're not keeping your home environment clean. You're not talking to other people. You're not eating right. Your sleep hygiene is out of whack. If you're finding yourself in that circumstance, I would, and I have myself at times, I would reach out for help from somebody else. Because if you're really not functioning in many areas of your life, help from outside can make all of the difference. Then the sort of self-administered tools that are possible are really setting ourselves up to have contact with other human beings, number one. Find activities that are interesting and comforting that you can do during the pandemic and within the limits of physical distancing. And third, reframing things. Understanding that something that we might initially judge as a negative might be an opportunity or a good thing in disguise. So those are tools that I've used. I don't want to spend the entire time we have together talking, though, as what I'm here to do. I'd really like to hear your questions or your concerns about what I've discussed and about how you're coping with the circumstances at hand. Whether or not you feel like you have resilience, like you've been able to thrive and take good care of yourself during a very challenging period of time, because you may have solutions that I haven't thought of or haven't spoken of today. And I'm very open to other people's suggestions as well. So I'd really like to open it up for questions.
Scott, if you could open up your chat, we generally have the Live Well Senior members put their questions in the chat.
Very good. I am opening it here. There we are.
And if anyone has a question and doesn't know how to do chat, you can raise your hand if you know how to do it in Zoom, but I will be scanning the screen to see if somebody is raising their hand like this. But if you know how to use that feature, then we'll use that.
I'm sorry, say that again. I'm reading in the chat as you're speaking to me.
Okay, if somebody doesn't know how to use chat, they can raise their hand. If they can use the raise hand feature, that would be great. Otherwise, I will scan the screens to see who is raising their hand.
Very good. So the chat's open, and also happy to call on people if they raise their hand. I see some nice feedback here as well that I'll share with you. Well, I think it's publicly visible if you open the chat, about one of our members here who had worked for 45 years as a registered nurse in psychiatric services and is thinking about renewing her license. Talk to me. Happy to hear that. Re-entering the workforce can be a really meaningful and significant life change. So yeah, that's a great idea. Hello.
One other thing I do want to mention, if you do put a message in the chat, please make sure that it says to everyone and that it's not a private message to Scott.
Oh. Well, you're welcome to read it if you want.
I'm not sure who's speaking there. Is that Louise?
Louise, that was Louise.
Okay, well, so it was a direct message, but I'll carry it to everybody. Thanks so much for your excellent presentation. I worked as a psych nurse for 45 years and have been retired for the past couple. Found your words so clearly spoken and understandable to everyone. Having the ability to provide hope and encouragement to others is a gift. What nice words. Thank you, Louise. I'm now thinking about renewing my RN license and going back to work on a part-time basis. Thank you again. So thank you, Louise. Those are beautiful words. Some more thanks from actually one of my friends who's one of our emergency department nurses, Bernie. He said, thanks, Scott, for the webinar. I watched it during part of my lunch. So let's see, Zelita, her messages to everyone. She's trying to do 3 things: about money, about her apartment, and about physical exercise. That's really, really valuable, Zelita, that physical exercise is really very important. Nina, everyone can see that there, that what works for her is to stay involved and connected. As I said, first and foremost, our pathway to other people is really the lifeline we all have to hold on to. Even if it's not physically seeing people, seeing them through electronic media or on the telephone or at a physical distance in an outdoor location, those are methods that we can use to stay connected to other people. Nina was saying that during the past year, since I live alone, find myself going to drive-through just to be able to see someone face to face. I totally understand that. There's a period of time where we were so walled off from the rest of the world that just seeing another person's face and their smile and their eye contact, those are meaningful things. So thank you for sharing that with us, Nina.